Welcome to the Retirement's Next Steps podcast. I'm your host, Jill Templeton-Haislip, Global Real Estate Advisor and Senior Real Estate Specialist with Russ Lyon Sotheby's International Realty DeGeorge Partners. This podcast is a valuable resource for retirees looking to connect with industry experts who can enhance your retirement experience. With so many companies, products, and services available, it can be overwhelming to know where to start. Let us help you navigate through it all and find the resources you truly need to make the most of your retirement years. As always, you can join us in person with each of our industry experts for the full presentation every month on the last Thursday at 4 p.m. Our office is located at 16872 East Avenue of the Fountains, Suite 103 in Fountain Hills, Arizona. Thanks for tuning in. Let's get started. Hello. Today we are here with Dr. Condon and Claire, who are going to tell us a little bit about how to stay healthy. So this is our Summer Healthy Retirement Series, and I'm going to go ahead and start with Dr. Condon. Tell us a little bit about who you are and what is your business.
So I'm a chiropractor. I've been in practice for 25 years. We did 20 years in Massachusetts, and we've always been a corrective care chiropractic office, which means we're going to see people with symptom issues, of course, back pain, neck pain, sciatica, headaches, all the common things and injuries. But really what we try to teach people is the importance of maintaining a healthy spine throughout the course of their lives into retirement.
Perfect. And what brought you out here to beautiful Arizona?
The sun. I saw 360 sunny days a year. Sign me up.
Perfect. Good answer. And Claire, tell us who you are and what is your business?
So I'm a licensed massage therapist, and I'm inside of Dr. Condon's office. And I too help people condition-based massages. First and foremost, helping people with stress and anxiety. That's usually what they're in there for. But I've worked with conditions like Parkinson's, pre-surgical, post-surgical, sciatic nerve pain. I support a lot of his patients, so it's been passionate in my heart to really help people for their pain and inflammation.
Sure.
You know, as we talk about being 55 and older and functional health and living, this is it. Get the body functioning so you can get out there and live your life.
Absolutely. I am a client of your guys's, so I do see quite a few age ranges that come in there, but I would say that I do see a lot of older folks who are in there, which works great for our retirement series. So obviously don't tell us any client stuff that you can't, but what would you say is the main reason first, Dr. Condon? Who are you seeing the most as far as what are their concerns? What should people who are watching this podcast be thinking about that we need to come in and visit?
I think there's a saying in chiropractic that suggests that symptoms are always the last thing to show up in all disease. Spinal decay is a disease. So the spine should last your lifetime. And if you take care of it, it will. It's really analogous to oral hygiene. So going to the dentist periodically, we try to teach our patients that if they take care of their spine, starting when they're young and preferably before they get injured, they'll find that they can avoid a lot of the things that we see very commonly in 65 and older, right? Where they're going in for spinal stenosis, compression-related issues with the discs and the nerves. Sometimes these things warrant surgery. So we're showing people that some of the time we can help with corrective things that we do that don't involve heavy spinal manipulation.
Mm-hmm.
As they get older, that really wouldn't be a good technique for them. But with other techniques that we do that are really safe, they can actually start to reverse some of that damage, but it's always better to prevent.
Absolutely. Now, I know sometimes when people hear chiropractor, they kind of probably back away from you a little bit, right? I mean,
people don't know what they don't know, right?
Exactly.
Yeah.
So tell everybody what makes you different from your typical, sometimes maybe scary chiropractor.
Yeah. So I think that the thing is the scary piece comes in mostly because of the unknown. The reality is that chiropractic is the safest healing art on the planet. In fact, taking Tylenol as prescribed over the counter is far more dangerous than a chiropractic adjustment.
Oh, okay.
So it's so safe. You know how insurance works, right? So it's about risk, isn't it?
Yeah.
And so my practice and the things that we do are so safe that my malpractice coverage is cheaper than my car insurance.
Wow.
And I'm a good driver. So I don't pay high premiums. So the reality is that what we do is safe, and we teach people that we try to demystify it. When we can take away the unknowns, the fear goes away.
Mm-hmm.
But people can feel reassured to know that our training is such that we are aware of those risk factors. And so I wouldn't adjust an 85-year-old the same way I might a 25-year-old.
Sure.
Things like that. But the thing that really differentiates us is that we're evaluating patients not only based on the symptom, but we're looking at their spine via X-ray or MRI, and we're identifying those abnormalities that might require otherwise pain management, surgery, things like that. And we'll do a thing called non-surgical spinal decompression. You're familiar with this.
Yes, I am.
And so it's a very gentle, think of it like the most gentle version of traction, but it's more sophisticated because the sensors in the machine can help prevent muscle guarding during the very gentle stretch. So we have patients laying there, as you might know, and fall asleep. And so they're getting this really productive stretch that allows pressure to be released from the discs and off of the nerves. So we can actually reverse these degenerative conditions a lot of times to help people, avoid surgery.
It's quite impressive. I'm going to be honest. The very first time I came in your office and I saw those tables, I was like, I'm never doing something like that because the thought of it scared me, right?
Yeah.
But because I fully trust you, I was
Thank
like, okay, let's give this a try. And I did. And I'm very, very thankful that I did.
Well,
I
we're thankful for you.
I would imagine that there are probably other people who have similar concerns to that. I've been a patient, so I know how you speak with your clients and all of that. But, how do you help to reassure some of those fears, especially maybe for the older folks who may be a bit more hesitant because they are older and they feel they're more fragile?
That's a great question. I think a lot of people are relieved to find out initially that most of the time, if we're talking about, say, 65 and up, which I see a lot of, right, in this area, they are happy to know that I'm not going to be bringing them through a very high velocity, forceful joint manipulation. They call it the cracking adjustment. They don't want the cracking. And the cracking is really interesting. It's just a pressure release from the joint. It's literally a gas pressure that comes out. It makes a sound. So we're not cracking bones, but I think it's reassuring to them that nothing I do is going to be that rigorous. And then when I explain to them that they're going to simply be laying on this machine that very, very gently stretches and it's very relieving, I think they find that appealing.
Yeah, I agree.
Yeah.
Now, Claire, you have more of the nice, comfortable side to things. When people think of a massage, it's because, they want to feel better. They want relaxation. I think it's amazing that you are in the same office, that you can help to support and share. I would imagine a lot of the same clients. So tell us a little bit about how you guys do support each other and what maybe your typical client looks like.
Sure. So I do have a lot of clients that come in for that wellness piece. They come in once a month to get awareness in their body, what's going on, what's tight, what's not, get things loosened up and move on. So I love that kind of person. They have that awareness to, maintain their health, like going to the dentist. I'd love to see people monthly so that we don't wait until we have an event.
Okay.
Let's stay healthy. However, how do I support Dr. Condon is the ability to do condition-based massages. Like I said, I had frozen shoulder. I had 5 Parkinson's people just last week, post surgery on a foot, on a hip. I've had his patients come in after decompression for the massage to support, like it's, for instance, sciatic nerve.
Okay.
I might need to get into the glutes and release the piriformis and the glute muscles. And so it really supports the correction he's working with on the spine, but I got to go in there and work with the muscles. Wow. So it doesn't kind of revert back. Although what he does, it doesn't revert back, but this just helps the person through pain and inflammation, kind of expedite comfort.
And can I speak to that too?
Yeah.
Because I love that point. I think Claire addresses something that a lot of people don't understand, which is that the muscle will only do what it's told to do. So if you're going to exercise, these are voluntary muscle contractions. But otherwise, the muscle will still contract, and it's the body demanding it compensate. And you should ask why. What is it compensating for? Why is this happening? And it's because there is a demand on the skeleton, on the spine, that's requiring a recruitment of muscle in a way that's not natural. It's the body's best defense at helping to stabilize and create balance. So it's just over time, it's inefficient. And Claire's great at addressing, at eliminating that stuff. So we're not always in a tug of war with the spine.
Okay. That's good.
Yeah.
You touched on Parkinson's. I worked in senior living before, and so
Mhm.
we did start to see as time went on, there were more and more people who are being diagnosed with Parkinson's. So tell me, how does that massage piece work with Parkinson's? How does that help them?
Excellent question. So it goes with the quality of life. I'm actually giving them some reduction of pain, improve, helping with the posture. I'm not going to prevent, the Parkinson's. I'm not going to cure it.
We wish you would.
I wish I would. Yet sometimes, the fascia and muscles are so tight. I can provide, you know, some looseness there so they have a little more flexibility. They can turn over in bed. They can get up
That's great.
out of bed. Just with his work coupled with mine, we've seen people come in the office with walkers, canes,
Sure.
crutches, various kinds of assisted care to being able to do things on their own again.
That's awesome.
So for someone to need somebody to help them out of bed to be able to do it on their own, that's a big
That's a
deal.
huge success.
It's a huge success. And I also incorporate, not only my hands and the different techniques I use, but I use a laser from time to time that really seems to be making a difference.
Okay, tell us a little bit more about the laser.
So it has combined biomodulation, which is red light therapy. Big word.
Okay.
Yeah. Red light therapy with a micronic TENS unit. So some people may have had a TENS unit where it stimulates the muscle, the muscle. So micronic, meaning this is going to be really small, where I'm stimulating the cells. So the laser is going down to the cells, and so it's the okay, help me out there, the TENS unit.
Okay.
So together, those stimulate the healing response, reducing inflammation, because all healing starts down at the cellular level. So I've seen regenerative properties. A woman had a tear on her foot, a ligament. She was going in for surgery. She had to wait about 6 or 8 weeks for surgery, but in the meantime, she was using the laser. She was awake during surgery. During surgery, the surgeon said, "Wow, this is starting to reattach."
Oh my gosh.
So, and Dr. Condon can speak to this. The body has an innate way of healing. It has its own healing process. We just have to learn how to stimulate it.
Right.
Red light therapy, one of those components, as his decompression table, massage therapy.
Then there's a couple other products that you use as well. There's a sauna, correct?
That is correct.
Okay, tell us a little bit about
So I love to have somebody after massage go into the infrared sauna. It's a dry heat. So it heats the body from the inside out, again, going right down to the cells.
Yeah.
So it promotes blood flow, reduces inflammation, and pulls out toxins, which is so wonderful. So great for that. There's also red light therapy in there, again, so that's great for reducing inflammation, skin tightening and lifting, why is that important? That's where we house our immune system. So we want that. That's a great defense for us.
Yeah.
To have that piece. And then I also have dry salt in there. So
that's right.
Dry salt is ground up and dispersed through the air. So it lands on the person's skin and it's breathed in through the respiratory system. So it reduces inflammation, brings in moisture, pushes out toxins. Great for allergies, great for skin conditions.
Yep.
So a whole host of benefits.
We could spend all day.
That song
You
really is
absolutely can.
quite something. It really is strong in terms of its boost to the immune system.
Now, I know you have more products than just the decompression. Tell us a little bit about what else you offer.
So besides my hands,
Yes, of course.
it's been historically the majority.
And let me interrupt you real fast on that. I want everybody to realize that you are the one who is meeting with every single patient who comes in. It's not Dr. Condon is there overseeing staff. And I love that you meet with every single patient and that you truly are hands-on.
Yeah, I think it's a really important piece of the practice. Obviously, chiropractic, the word means done by hand. It's from a Greek word chirurgics, meaning done by hand. So I think to emphasize the power of the adjustment cannot be overstated. I think we've seen people be able to recover themselves from almost anything, whether it's, some kind of dysregulation with their metabolism to bowel dysfunction to can't get pregnant to whatever it might be. We're restoring normal function to the body. And the adjustment is the only healing art that we know that can do that. And so the chiropractic adjustment is really unique and powerful. Most people think of it as something that we're going to do to relieve back and neck pain. Though that's true, the very first adjustment was given to a man who was deaf, and he lost his hearing when he injured his neck. And when he got adjusted, his hearing was restored. So that's the genesis of chiropractic, was a story about the relationship between structure and function, between the spine and the nervous system. And so I think that's really important for people to understand, and that we could do that by hand. We could do it with instruments. We can also use a class 4 laser, which is powerful. And we'll use that really selectively for, we have a national peripheral neuropathy program that's really designed, it's 90% effective at helping eliminate peripheral neuropathy. Now, these people struggle with numbness issues that are persistent. It's usually post-diabetic, post-chemotherapy, or trauma. And they can't get resolution. They're being told, take more drugs, more gabapentin, more Neurontin, more Lyrica, whatever it is. And they're getting not better, they're getting worse. And the problem with that is that neuropathy is the number one non-traumatic cause of amputation in the United States. It's about 100,000 a year. So people are losing limbs, they're losing toes and feet and hands and things like that. And so we have about a 90% success rate at helping eliminate diabetic peripheral neuropathy and post-chemo neuropathy with class 4 laser and vibration. Sometimes Normatec boots. I don't know if you have seen that, but that's a pretty cool tool for that we put in the legs that pressurizes and increases blood flow to the legs. So there's that. And then there's the decompression we spoke of. We're the only provider in the state of Arizona with the Spine Med, which is a patented direct restraint system, where all the other so-called decompression machines use whole body harnessing and pulley systems. This is a direct, gentle capture under the skull or over the pelvis, depending if we're working on the neck or the lower back. And it makes it very comfortable for the patient. We can deliver very, very low force and create a great effect. And then we have a knee on track machine. So a lot of degenerative knee issues. So we see arthritic issues, meniscal tears, things of that nature. And they could go on this knee decompression machine called the knee on track. And essentially that opens up the joint. And while it's opening up the joint, we'll laser the knee to speed up the healing process.
Oh my gosh, that's cool.
Yeah, it's really cool. The laser's powerful. What Clair does is powerful. What we do for those types of injuries with the laser is really powerful. It helps regenerate tissue. Just think of it like the cells are solar panels and the laser is the sun, and it's charging the cells to amplify their activity. It's really that way. And so it amplifies healing rates by 3 to 8%, somewhere in that range. So if you're suffering with chronic pain, it's a pretty cool tool.
Yeah, definitely.
Yeah.
So tell me, when do people want to call you? For example, I'll go ahead and tell my story. I started having back pain, and right away, because of the relationship I have with Dr. Condon, knowing him through the Fountain Hills Chamber of Commerce for going on 6 years now, I think, I automatically said, I'm going to call you. But not everybody knows you, so not everybody's going to call. So what do you want to have people maybe call you before they go and see their primary care physician, or, kind of walk us through what that looks like?
That's a great question too. A lot of people don't know when to see a chiropractor, right? And I guess I would say, if you can understand that there are options out there, there are different goals that can be satisfied depending on what you're trying to achieve. Chiropractic is unique in its ability to restore normal structure function to the spine. We're talking about doing something that doesn't involve constant treatment or medication or surgery, removing body parts. I think it's important for people to know that there's a non-invasive, safe, and effective way to do that. And I think the best way to do it is, if you have any symptom that seems like it's chronic, your body's having a hard time adapting, that's a signal. That's your body letting you know, right? Because healing is actually the natural state. So to be in a constant state of sort of abnormal, if you will, and static and chronic, that should be like an alert and say, okay, well, what do I want to do here? Do I want to cover it up? Do I want to take a Tylenol so I don't feel it? Well, it's not a contest to see how miserable you can be. So I get the reason why people do that, but we think people should come in when they have a chronic sign or symptom. And even if, you want to come in way before that, that's the ideal. The reality is that most people wait too long.
Sure.
So whether it's sciatica, back pain, neck pain, tingling and numbness in the arms and hands, we're trained by virtue of our education and license as primary care providers. In reality, in the real world, we're not treated that way by insurance companies, which is a whole nother political mess that I won't get into. But that is the reality. But people can come directly to us without a referral.
Yes, which is nice.
Yeah.
And what's really great is that when you do call the office, you speak to his very lovely wife, Allison, and she is really good at listening to exactly what the needs are and kind of giving you some direction there. So I like that it's not an answering service. You're talking to somebody who knows the business, which is really nice. Claire, tell us a little bit about you want people to come in not when they're in pain, preferably they would start seeing you because it's good. But when do you really want folks to think, oh, this is the time?
Same with Dr. Condon when they don't feel well, when there's discomfort. And not feeling well with the services I offer can be when you have a cold, when you're feeling run down. There were folks.
And people don't think of that.
They don't. They think, oh, I'm not supposed to go out because I'm sick.
Uh-huh.
I had a lot of folks coming in right before Thanksgiving and Christmas, especially because they had a cold or flu of some kind.
Mm-hmm.
And they were due to fly. They were due to travel in some way. So they would come in and get a massage and use the sauna.
That's great.
Because the massage will pull up toxins and the sauna will pull it out. And coupled with that salt therapy, it really, really makes a difference and
That's
gives
awesome.
them their quality back. So,
Whenever.
as soon as they get hurt, as soon as they get sick.
And they can come in perfectly healthy too. They just
Perfectly
want
healthy.
to have a massage.
Absolutely. And I always take a phone consultation or in person, whatever they like, they want to get comfortable. That's perfectly fine. Ask me questions. So
Great. Are there any myths or misconceptions that people have about either one of your businesses that before we wrap up, you guys would like to address? The floor is yours to address if you feel like there's anything you really want to make sure, because not everybody who's going to be watching this were able to come. And so they weren't able to hear your whole presentation. So is there anything else you just really want to put out there for our retirees who are listening today?
Claire, go ahead.
I think a myth I had with massage and these services, it was just a luxury. And it's,
I can see that. Yeah.
It's foo-foo-y, it's luxury, it's a waste of money. Well, it's not. It's healthcare, and I do take health saving cards. I don't take insurance, but I do create super bills for people because many people are able to submit that to their insurance and get reimbursed because, they are starting to recognize the benefits.
Yes.
Mm-hmm. So I've had many doctors write a referral for their patients.
Excellent.
Yeah, and I think for me, with chiropractic, it's demystifying it. Like I started by saying, it's not unscientific. It's not this maybe kind of thing. It's not how do I know I'm better? Or, I had an orthopedic surgeon one time say to me that I think what really happens in chiropractic is the patient just starts to feel better, and they think they're better, but they're just feeling that way as if it's like this placebo effect. And I said, well, that's an interesting theory. And worst case scenario, you're right. If you're right, that means now I have a patient that has chronic pain that's been living on Vicodin, and now they got adjusted and they just think they're better and they don't have to take Vicodin. That's a win.
Yeah.
But you know what? We take it a step beyond that and we say, you know what? It's not just about how you think and feel. It's about the reality that your spine should be in a normal position.
Mm-hmm.
And we can actually do things to alter where you are to bring you closer to the ideal. Then take another x-ray and show you the before and after.
Yes.
So there's really no debate at that point.
Exactly.
Patient feels better, but they can see why.
Yes. Yes. So how do folks find you guys? What is the best way to get in touch with you?
Well, for me, I love a text. That's the fastest way to get a hold of me at 480-285-9475.
Okay.
Also, targeted-massage.com. Check out my website, see my story, and they can book services, including a consultation right there.
Okay, wonderful.
Yeah, we could be reached at 480-809-4700 or at allyspinecenter.com, ALLY spinecenter.com.
And they are located at Frank Lloyd Wright and Shea in those little office buildings that are located right there. So if you're in Fountain Hills, they are stone's throw away. If you're in Scottsdale, they're also, just easily located. I want to thank you guys and tell you how much I appreciate you coming in today. I think this is great information for folks to know because what they don't know, can hurt them, right? Mm-hmm. So now we've educated on different options, especially with the Parkinson's and different ways that you can still maintain health when you're older. It's not once you hit a certain age that it's all downhill, right?
Right,
Thanks for
right.
having us. This has been great.
Absolutely. Thank you for listening to another episode of Retirement's Next Steps podcast. If you have any questions, please don't hesitate to contact me at 303-204-4432 or via email at jill@degeorgepartners.com. If you would like to attend one of our Retirement's Next Steps workshops, you can find the schedule on our website at Templeton-Haislip.com. Make sure to subscribe to Retirement's Next Steps YouTube channel and follow us on Facebook and LinkedIn. Wishing you a happy and fulfilling retirement. We look forward to connecting with you again soon. We're good.